Today we are going to discuss a developmental disorder that is named autism spectrum disorder. The objectives of today's presentations might include number one, the definition of autism spectrum disorder, and number two, it might include diagnostic information regarding this disorder, and number three, contextual information regarding this disorder. And in the end, we will discuss some strategies to cope with the disorder. Let's start from the definition. According to the definition, it is a disorder with problems in social communication and social interaction and restricted repeated patterns of behaviors, interests, or activities. Characteristics of this disorder might include that these type of symptoms are mostly developed in the child with less than 3 years of age. The symptoms might include repetitive actions in daily life. It also might include the stereotype movements shown by such type of child, and they are always resistive to daily routine change, and they also are very resistive to the change in environment in their surroundings. They also show some type of unusual type of responses to the normal stimuli. Okay. According to the DSM-5 criteria, a person with autism spectrum disorders are always deficits in social emotional reciprocities.
They show abnormal type of social approach, normal back and forth conversation with other inmates. They are always reluctant for sharing of.
They fail to respond different type of the social stimuli interactions. There are deficits in verbal, non-verbal communicative behaviors that may ranging from the poorly integrated verbal and non-verbal communication to abnormalities in eye contact and body language, or deficit in understanding use of gestures, or total lack of facial expressions. Deficit in developing relationships with others. The severity of this disorder might be dependent on social communication impairments, and they are restricted repetitive patterns of behaviors, and they have repeat side type of behaviors over and over again, and they also show a stagnation to some pattern, and they feel happy if they are pertain to some repetitive patterns. They are hyper or hypoactive to the sensory inputs. And they also have some strengths and some weaknesses in their daily life. The strengths of such type of person may include conceptual skills. They have good conceptual skills, and they have modeling ability, model complex situations. They have logical thinking of different situations, and they have exceptional type of memory, and they also have attention to the. They also pay attention to the minute details, and they are always laser focused to specific topics, and they also contain independent thinking. They have good visual processing memory, but they also have some weaknesses such as social and communication deficits. They are social and communicative deficits, speech language problems. They have severe type of problems, and they have restrictive abnormalities and skills. They are resistive to minor change in their environment, and they don't have ability to recognize deceptions. They also have perceiving. They cannot perceive emotional state. They show inability to grasp pictorial information. They lack the capability to be motivated for areas of non-interest. Activities and strategies to cope such type of problems are following. Number one are academic support that is given to such type of children, that include teaching them some social skills that are taught in some areas and some schools. They are also given some graphical support and to cope with such type of situation. They are taught to adjust number of items, explore areas of interest, how to explore the areas of interest. They are also taught to adjust the time, task, breakdown. They are taught to break down the task in different portions. Behavioral support might include the following. That includes some fixed type of schedule is given to such children. Any change in fixed type of schedule might make them very anxious. So a graphical type of schedule is always presented to such child, in which rules are taught to the child, and full feedback is always given, that if their response is appropriate or inappropriate in their activities. So coping plan is always taught to them in difficult situation. Social support for such type of children might include social stories are taught to given to teach them social skills, social laws, and events that might include a difficult situation and reactions to such type of situations that a child with autism might endure. Educate the peers to behave with such type of children. Social reinforcers are always given, that might include clapping if they produce such appropriate type of response. Rules of societies exchange are taught to such type of children, that might include how to paint or draw. PEX technique is used, that might include picture exchange communication system, in which they are taught how to exchange.
Visual schedule is good as they can retain it easily. Interaction with parents can be more helpful to treat child with ASD. Have you found this video informative? Then subscribe, share, and press the bell icon for future notification.